development credits for attending today's session, you will need to complete the post survey. We will also be raffling gift cards after the summit concludes. And in order to enter the raffle, you will need to complete the post survey. Now I am excited to introduce our speakers for today. Leading the session, we have LUCHA Tabaco, Health Education Council's tobacco prevention program that is dedicated to reducing health disparities in Latino communities in the Gold Country region. We also have Scott Kazer and Jeremy Combs, both program specialists from Twin Rivers Unified School District, who support and implement the Tobacco Use Prevention Education Program, or TUPE for short. This is a program that focuses on providing prevention, intervention, and cessation resources for students in grades 6 through 12. I will now hand the floor off to our presenters.
Okay, I'll start. Hello, everyone. Thank you for joining us. So for today's presentation, I'm with Health Education Council, Johana Ramirez, and we'll be talking about Tobacco 101. And then we'll hand it off to Twin Rivers Unified School District, who will speak on youth and on their TUPE program. And then we'll have some Q&A, and then we'll end with our survey for you all. Next slide. And then this is just some more information about Health Education Council. And like Sal had already mentioned, so we don't really need to go through this, just about our program with Lucha Tabaco, which stands for Latinos Unidos contra el Hábito y Adicción al Tabaco. So our program, we offer workshops, trainings, assistance, for school staff, clinical staff, health professionals, and for parent and community groups. So next slide. So the evolution of tobacco smoking products. So as we've seen, tobacco products, they have continued to evolve, from starting out as, regular cigarettes to now we have all these different types of products with e-cigarettes and vaping products. And they are becoming more popular among the youth, and youth are more likely than adults to use these e-cigarettes. And in 2019, 18.2% of high school students in California used electronic vapor products on at least one day in the past 30 days. And nearly 200,000 high school students currently use cigarettes and other tobacco products. And e-cigarette use among youth, e-cigarettes and vaping have threatened the years of progress made towards social norm change. And this current generation was thought to be the one to end smoking, because the traditional cigarette products weren't as appealing to youth. But now with these new products, that has changed. And in 2020, 19.6% of high school students and 4.7% of middle school students, they reported current e-cigarette use. And among current e-cigarette users, 38.9% of high school students and 20% of middle school students reported using e-cigarettes on 20 or more of the past 30 days. So they're definitely using them a lot more. The numbers are increasing, but according to that graph that you guys see, the numbers are lower than they were last year, but it's still, an ongoing issue. And we wanted to show you guys an example that there are many different types of e-cigarettes that are out there in the market for teens to use. They are becoming, smaller and easier to hide. And e-cigarettes come in many shapes and sizes. So we wanted to show you a picture example of how easy it is for them to, you know, hide and be disguised among different items. So if you want to click next slide so we can show the picture. Yeah, so if you guys can just try and see, you know, how many tobacco products you can see in this picture. And then we'll show you right now how many there actually are if you want to click next slide. So there's actually 17 tobacco products within this picture. So I mean, that is a lot, especially because, you know, they come in different shapes and sizes, and now there's different colors. So it's easier for them to hide, you know, amongst pens and pencils and, you know, different school items. Next slide. So different types of e-cigarettes, as you can see from this picture, there's different, there's closed systems as well as refillable open systems. And a lot of them, then there's also disposable types that are in the closed system. So there's many different types of e-cigarettes. Like we said, there's different shapes and sizes. And it feels like, you know, every day there's always a new product coming out. And to describe more about these products, most have a battery and a heating element, and as well as a place to hold a liquid. And those would be the refillable open systems. And some e-cigarettes are made to look like regular cigarettes, cigars or pipes, and then others resemble pens or USB sticks and other everyday items. And e-cigarettes, they can be used to deliver marijuana and other drugs. And like in this graphic, these are some of the different examples that there are. And consistent with 2019, pre-filled pods or cartridges were the most commonly used device type in 2020. However, during 2019 and 2020, the disposable e-cigarette use increased dramatically, and it jumped from at least like 1,000% among high school current e-cigarette users, from 2.4% to 26.5%, and approximately 400% among middle school current e-cigarette users. And it's just because, you know, their availability, it's easier just to dispose of them and buy new ones instead of having to, you know, refill them. And there's just so many different types of disposable products out there. Next slide. And flavored tobacco and vaping. So it's well established that flavors play a significant role in enticing youth and young adults to try and use tobacco products. And tobacco and vaping companies, they target kids with sweet and candy flavors to mask the harsh taste of tobacco. And 80 to 85% of youth say their first tobacco product was a flavored product. And some of these flavors include menthol or chata, bubblegum, chocolate, and there's many more. There's actually over, you know, 15,000 types of flavors out there, which, you know, makes it a lot more enticing for youth to use these products. Next slide. The hooking youth with flavors. So what is the attraction to e-cigarettes? And it's, you know, that these products are flavored. Compared to traditional cigarettes, those don't have flavors except for menthol. And these products, there's so many different types and so many different flavors. And tobacco companies know that the flavors attract youth, and they exploit this by selling the over 15,000 types of flavors for these products. And 80% of tobacco users start before they start using before age 18. And this is due to a lot of many reasons, and over half started with menthol cigarettes, since this is the most popular and common flavor that they are sold in. And youth cite flavors as the top reason for using e-cigarettes, and 97% of youth who use vape use flavored products. And among high school students who currently used any type of flavored e-cigarettes, the most commonly used flavor types were fruit, mint, and menthol. And among middle school users, the most common flavor types were fruit, candy, desserts, and other sweets, and followed by mint. And we'll briefly talk about the SB 793, the flavored tobacco ban. So we'll talk about that more coming up. So next slide. advertising to teens, social media helps to fuel the popularity of e-cigarettes, and tobacco and e-cigarette companies have capitalized on social media influencers to attract teens. And e-cigarette manufacturers, they resurrected the marketing practices used by tobacco companies that were used for decades to attract kids to smoking. And some of these tactics have been prohibited for tobacco companies because they are appealing to kids. And I think for some of these products, especially like for Juul, when it first came out into the market, it was heavily advertised on social media, on Twitter, and on Instagram with influencers, and with the hashtags and everything. But now there are definitely a lot more regulations for advertising on social media, but there's still a lot of ways for these information from these products to get to youth. Next slide. So are e-cigarettes really safer? Vaping may be less harmful than smoking, but it's still not safe. And as we've seen through the, there's, outbreaks of lung injuries and deaths associated with vaping, when these products first came out, and, there was a big rise in their use. And research suggests that vaping is bad for your heart and lungs. And e-cigarettes are just as addictive as traditional cigarettes. The nicotine in one vape pod is equal to 1 pack of cigarettes. So they still have a lot of the same dangers associated with them. There's the addictive property and the nicotine, as well as cancer-causing chemicals that's found in e-cigarettes as well as traditional cigarettes. And as we've seen, this new generation is getting hooked on nicotine, and it's because of these e-cigarettes and vaping products. Next slide. And just quickly talking about, smoke, how, smoke is smoke. There is no risk-free level of exposure to secondhand smoke. And that's coming, from traditional cigarettes and even some vaping products. And short-term exposure, can increase the risks of heart attacks, and it contains, secondhand smoke contains, lots of chemicals that are known to be toxic and carcinogenic, and it's especially harmful to young children. So it's definitely something to, the use of these e-cigarette and vaping products lead to the use of traditional cigarette products, and then that's associated with the dangers of secondhand smoke and third-hand smoke. Next slide. So just some conversation starters that you can have with your students. You could ask them, tell me what you've heard about tobacco and what do you think about e-cigarettes, and tell me what you've heard about smoking and health, and how long do you think you have to smoke for it to affect your health. And we know that reaching young people with the facts that they need to make informed decisions is critical. And many young people did not know the health risks of e-cigarettes when they started using them. And in a 2018 study published in Tobacco Control, 63% of Juul users did not know that this product always contains nicotine. So it's good to have these conversations with students just to gain an understanding, what they know about tobacco and these products. That way you can, start educating them about this topic and the dangers associated with them. Next slide. And some progress made in tobacco control. We've seen, in the past few years that there has been an overall decrease in tobacco use with all of these various tobacco bans and laws, like the Tobacco 21 law. We have smoke-free and tobacco-free schools, and now there's a lot of local policies and restrictions that are being implemented, regarding flavored tobacco bans and tobacco retail licenses, and sale restrictions on all flavored tobacco products, including all types of menthol products. They are gaining momentum at the local and state level. Next slide. So SB 793, this is a flavored tobacco ban, and this California bill bans the sale of menthol cigarettes and all flavored e-cigarettes statewide. as well as flavored non-cigarette tobacco products, such as smokeless tobacco and some cigars. It does contain several exemptions for hookah and premium cigars and pipe tobacco. And the implementation of California state law restricting sales of flavored tobacco products. It is suspended and right now, and it remains ineffective because the tobacco industry, they saw a referendum, and the law will be voted on by the state's voters on the next statewide ballot, which is scheduled for November 2022. And it's just important to keep, working and advocating for this law to go into effect. The more action, we take now, the better chances it is for it to get passed. Next slide. And so talking more about advocacy and, how you can be an advocate in your community. We know that the action needs to be taken, and we can all be a part of that. And there is a need for local flavored tobacco bans and other smoke-free laws. And right now, some examples: the city of Sacramento, they in 2019 they banned flavored tobacco, and the city of Rancho Cordova, they banned smoking in apartments in 2020. So some things that you can do to be an advocate and be involved is, submit a letter to your city council or provide a public comment, as well as joining a local coalition. And currently there are advocacy groups that are working with the SAC Board of Supervisors to ban flavored tobacco. And what our organization, the Health Education Council, what we're working on right now is on banning the sale of flavored tobacco in unincorporated Sac County and on smoke-free housing policies in the city of Galt.
Okay, I'm going to take over on this one. Thank you, Johana. That's a lot of great information. So my name is Jeremy Combs. I am a program specialist in student services, and I support the 2P program in our district. And I see some faces within Twin Rivers and then some folks in the 2P community. So welcome, thanks for joining us. So for those of you who don't know what the 2P program is, 2P stands for Tobacco Use Prevention Education. So it's a state-funded grant through Prop 56 and 99. These propositions call for a tobacco tax that allocates funds for school districts to provide programs really focused on education and being able to mitigate and prevent youth tobacco use. And really, the main focus of 2P, we're focused on prevention, we focus on intervention, and then cessation as well. And really just try to decrease pathways to other harmful substances down the road, such as alcohol and drugs and other, prescription medications and drugs like that. Go to the next slide, please. So some of the services that we provide, as I mentioned before, really focus around prevention, intervention, and cessation. But within that, we have programs that also, focus around youth development, which we'll be discussing. Some of the intervention programs that we'll do, we'll be talking more about our process within our district. And then cessation, is usually a referral for students that we provide intervention to. And if they're looking for other resources to help them quit, we have different agencies that we work with. As well as with 2P grant, this time around, we're in our second year of our current cycle. And this time around, they're asking for a family and community engagement component, which we've done in the past, but we really are working on focusing on broadening how we reach out to our families and communities. And lastly, talking about the surveys that we do within 2P, really that drives and informs the work that we do. And talking about the California Healthy Kids Survey and different surveys like that that are mandated, and then other information that we try to do to inform the program. With that, I want to pass it over to Scott Kazer, and he's going to be talking a little bit more about our district data. Next slide, please.
Next slide, please, Sal. So kind of like Jeremy said, we really utilize data-driven statistics from our district. And what you guys see here is kind of data trends based on our disciplinary infractions surrounding alcohol, tobacco, and drugs, really focusing on tobacco and electronic cigarettes. We were doing a really good job at cracking down through our programs. 2014, 2015 was at 66, and then the next year, 15, 16 was at 77. So we're there was an increase. And then 16, 17, 17, 18, with all the services that we pumped through our TUPE grants, we really got a good decline in trends. And then in 2018, 19, this kind of went back up again. And obviously, 19, 20, and in 2021, the data was very skewed, obviously, because of the pandemic. So we really didn't even track that data. Just as other folks know in different districts, it was very hard to get referrals from school sites because they weren't in school. So students were, unfortunately, they weren't getting those support services as they weren't being identified as users. And students were also not really reaching out for support. So we try to do our due diligence in promoting our programs, but even then, the parents didn't even reach out to us. Next slide, please. So one of the programs that we have prevention-wise, we have a curriculum called Catch My Breath. And we aim this at our elementary because we're finding that students are vaping at a much earlier age. And so Catch My Breath is it's a e-cigarette, nicotine vaping prevention program. We are tailoring to our 6th grade youth. It's a free curriculum. There's an online training that is free if staff wanted to take it, counselors wanted to take it, teachers, social workers that could implement. It's only 4 lessons and it's very, very user friendly and free. Free is the best. And it's a very positive curriculum. So we're utilizing that right now in all of our 6th grade schools or elementary schools. And we're looking at rolling that out very soon in October during the Red Ribbon Week, because I think it's a very good time with 4 lessons to implement during that Red Ribbon Week time, which is, from October 23rd to 31st. Next slide, please, Sal.
So the prevention curriculum that we use in our middle schools currently is Project Alert. So similar to Catch, this is a free curriculum. It's intended for 7th and 8th graders. It is a little more comprehensive as it covers more than just vaping and tobacco. It covers a lot of alcohol, tobacco, and other drugs as well. And it's actually with 7th grade, it's 11 lessons. And then with 8th grade, it's 3 booster lessons. With the pandemic last year, we did have to adjust the lessons that were delivered. So there's about 4 lessons that really focus within the 2B realm with Project Alert. You'll find that there's other curriculum as well that does offer. We chose to use this one. It's evidence informed. Our teachers have used it for many years. There's online training that's free to them. So there's a lot of great resources within the curriculum itself. And then the way we've tried to roll it out. So we learned a lot, obviously, throughout the pandemic last year and ways to adapt and keep programs going. So we've chosen to kind of reach out to our physical education, our PE teachers, and we attended their PE SAC meetings and try to talk to them about the programs and a little bit more just to get that support from them. And it was really hard to try to implement it last year. And health or science, they're completely inundated. And even this year, we're finding that our teachers, I'm sure you can relate, in other districts are overwhelmed just with the amount of extra work that's kind of put on them trying to make up for last year's learning loss. So really leaning on other teachers and looking at other resources to try to bring these programs forward is really important. We found that PE was really successful last year, and we're hoping to continue that this year as well. Next slide, please. So for our prevention curriculum in high school, we utilize the Stanford Tobacco Prevention Toolkit. This toolkit covers, as you can see from the slide, it covers pretty much everything around tobacco and vaping. And then it's really versatile into how you can kind of curtail the curriculum to meet your needs. What we found really helpful about this program, our initial intention was to roll it out in more of an in-person setting, obviously, where it's delivered by an instructor, by a teacher. However, last year, because of the pandemic, we've actually rolled this out through health in high school. So our health classes typically are 9th grade, but we also found there's 10th through 12th as well that participate. So we're able not to only catch our 9th grade, but to catch others throughout that 9th through 12th grade demographic. So it's really been helpful that way. And like I said, the self-paced curriculum is online, so students can go and they take basically a pre and post test that we kind of created that was similar to Stanford's test that they have on the site. So it's really great because the way it is, like, students can register, Stanford can work with you to help get the data back from students that registered to let you know their completion percentage, and then at the end they receive a certificate as well. But for the grant, we've had pre and post data that we use to track progress with students. So we kind of adapted that in a way to kind of meet some of the criteria that we have to meet for our grant. Next slide, please.
And so next we have a curriculum that is provided to our pregnant and parenting teens. We do this at one of our high schools called Pacific High School, and it's an alternative setting. There is a child development and life skills class that this is taught through. And really what it's trying to teach is more about, how tobacco, nicotine, how it affects the womb in the early stages as far as the fetus, how it affects, through secondhand smoke during pregnancy and after. And really it just kind of provides them with an understanding of the harm and effects that they are causing their unborn child or their newborn child and thereafter. So it's a very good, it's developed by Sacramento County Office of Education. It's been around for many, many years, but the students really like it because they do a lot of activities, one with their child in person, and then so they get the feeling it's front and center. Because what the students can do is they can bring the students to school. They have a child development center where they can drop their youth off at the school and then go to school. So it's really neat for our pregnant parenting teens. Obviously, we're trying to prevent pregnant parenting teens or students from being in that situation in the first place. But obviously, things happen, and we want to provide those students with the with curriculum and those resources so that they can be successful. Next slide. Jeremy?
Yeah, so the youth development aspect and what we offer, a lot of our partnership comes through Sacramento County Office of Education through our Club Live and Friday Night Live programs. Those programs are really intended to build leadership skills, focus on community engagement, and a lot of the activities there, well, they're really looking at preventing alcohol and drug use, but they encourage like a positive peer interaction and influence. They also, skill building activities with youth are huge with that program. And really students are allowed to advocate for issues that mean something to them. And although there is a set of activities that students are able to select from, really they drive the program. So the structure of that is there's a SCOE representative, and then we have an advisor that's typically a teacher at a school site, can be a counselor. We're actually looking at, possibly using some of our other programs outside of that, after school programs as well. But typically the model has been focusing more on teachers, counselors, social workers, as really those folks to help recruit students, participate, encourage them. But it is a student-driven, student-led program. And like I said, we have it at all of our high schools and most of our middle schools. It's been really successful. And actually, Scott's going to talk about a few other programs that we have, but we're going to show you a video that SCOE made that kind of highlights some of our actual programs and programs throughout the county in Sacramento.
We can roll it, Jeremy. That's fine.
You want to go and roll it? Okay. Let's go and roll it. So we're going to skip over. I'm going to share my screen. We found the audio a little bit better.
Friday Night Live is a club where we meet to spread awareness and information about the harmful effects of drugs and alcohol.
I thought they were just going to be in one group just talking about drug prevention, but we actually went out and did things in the school.
It's a club where you learn how to be a leader.
I think socially I've learned quite a few things in just a short amount of time I've been here.
The leadership program they're offering here
it was a step I needed to take.
FNL has taught me to be a leader and not a boss, to help others and not just take all the glory.
To me, being a leader means that you will put yourself out there regardless of what happens to you. You know, you have a message you want to say it out loud, even if your voice shakes.
It's so much fun. We do so many different activities and we work together, and it's like the highlight of my week every week.
We do a lot of activities and a lot of icebreakers, and like we got like a lot of our people at our school were very into them, and like people will be lined up like down like the stairs.
Feet on the road with your eyes on the prize, inch by inch, one step at a time. You're losing hope when you can't find a way.
My favorite activity when we went to back to school night, and we told the parents, we had them sign pledges saying that they won't give drugs or alcohol to kids who come to their house. More than half of the parents who came signed it.
I'm actually talking to other kids that can relate, and I could try to help them if they need it, and then they feel more comfortable with another student than their parents.
Okay guys, so you can come and sign a pledge card to be drug-free. When you help somebody, it doesn't only help them like have a smile on their face, it puts a smile on your own face, it warms your own heart, like you're giving but you're also receiving back.
It makes my heart feel good. It makes me happy.
My favorite part of FNL is being a part of something bigger than yourself. It makes me feel like I'm doing something and that my life has a purpose.
Yeah, Friday Night Live!
And kind of what, while Jeremy's getting back to the slideshow, I just wanted to hint on a lot of these programs between Friday Night Live and Club Live. The students are in theory leaders, and we teach the students how to do the outreach during Red Ribbon Week, which is our National Drug Prevention Week, October 23rd to 31st. So a lot of our students are driven to do outreach to their peers on campus to talk about the harm and effects of alcohol, tobacco, and drugs. So it's a really, really good program. Another one that we have is it's a mentoring program where students from a high school go down to the middle school level, and they're close in feeder school streams, and they mentor the students about similar things. We have Skill Week come out with an advisor or representative, and they teach a curriculum, and really the mentors link up, mentors from the high school link up with the mentees from the middle school, just to kind of be there as a kind of big brother, big sister type thing, and be there to talk to, be there to kind of guide them through the middle school years, which is very difficult, very vulnerable times, and then kind of be a bridge or a conduit that will go into high school the next year and kind of be a big buddy there as well. So it's a very, very positive program, and typically all these students are leaders on campus, so it's really, really neat to see. We also have our child development or our activities students, leadership students will participate in this as well, and they'll be doing a lot of outreach on campus throughout the year with different activities that with anti-drug messaging, anti-tobacco messaging, anti-vaping messaging as well. So very, very powerful programs, and SCOE does an incredible job at building the students up to be able to present or to be active in the community. Next slide, please.
Sorry, it's lagging a bit here.
Okay.
There we go. So our next piece is around family and community engagement. As I mentioned, although this has always been something we've incorporated with 2P, this is something we've really tried to expand. In our initial plan, actually our partners are Health Education Council, and we, in our grant, we initially had decided that we're going to focus on communities that have the highest, infraction rates, starting at those schools and working with those families to just provide more insight and information to them. However, with the pandemic, as everybody knows, with any program, we had to adapt. And we're currently, last year we did a virtual workshop series. I've included the flyer that showed what we did. We had a different theme each week, really focusing on, just the history, the impact, current trends, kind of the information that you guys saw a little bit today, and then really worked on talking about having the conversation with families, and then advocating for healthier environments, how they can be leaders in their communities. And the last session was really focused on like having just breakout rooms and talking about current issues they're seeing in their communities, really to give us a better understanding of what they're facing, because this is an ongoing process, and we want to continue to provide information that's relevant to their needs and their students' needs. And the Health Education Council has been a great partner in this. As we continue, we've seen trends. A lot of families are concerned about marijuana use outside of vaping. So we have other community partners on the youth programs that we've worked with as well. They provide great resources for that. Currently, our plan is for this year is to have our big kickoff during Red Ribbon Week. We're going to continue the virtual workshop series, just because we've seen, well, it's a wider reach, right? I mean, we cast a broader net as far as who we're bringing in, and then transportation is not an issue. And obviously with COVID still being what it is at school sites, we're still not really allowed to go back and have those in-person meetings. So we're continuing virtual for the foreseeable future for this school year. And we'll be having more trainings throughout the year, really focused around what families, let us know their needs are. So we typically do surveys at the end, and based on those, we'll build our programs to accommodate those needs.
So we have intervention services that myself and Jeremy provide the students if there are school infractions, and it's called Brief Intervention Teen Intervene. And school sites, school administrators can utilize this program in lieu of suspension. And what it looks like is if someone gets caught at school, or if there's a soft referral from a parent or a friend that's worried about a child, they can reach out to us, and we will provide intervention, which includes 3 intervention sessions, whether it's one-on-one or in groups with students who have issues with tobacco, with vaping, with marijuana, with alcohol. And we work with them to really discuss the harm and effects, do motivational interviewing, have them understand harm reduction, and really aim for cessation for the students. We currently have, I believe there's 25 counselors that are trained in our district on this, as well as we link up with interns from Sac State, social work interns from Sac State, and from San Jose State University. So they come in and also they get trained on how to provide this intervention. And since there's such a high need in our area, they really help to really get these services out to the students, because Jeremy and I are only 2 people, as well as counselors are often inundated with a lot of mental health nowadays. So we try and get as many resources as we can to pump those services to the students. What the referral process looks like, it just looks like at the school site, the admin contacts myself or Jeremy. They say, hey, this is what happened with X students. We are offering this in lieu of suspension due to the parents authorizing that, and we will not suspend them. So really, it's a great program. We also got the health administrator or health services staff involved as well for identification, for signs, and kind of resources in our district resources. They reach out to us as well. They talk to counselors, they talk with administrators, and then at the end, we always hear about it. We also, as a safeguard, Jeremy and I have a student database where it shows all the disciplinary infractions, and we can self-select which ones, and it can be controlled substances, vaping, tobacco, e-cigarettes, kind of those things. So really positive program, and we feel that it's very effective to decrease the recidivism rates for our students, and we track it, which is good. So we're trying to increase harm reduction and ultimately cessation. So we track that as well. Next slide, please, Jeremy.
Did you want to mention Care Solace at all, Scott? I know it's one of the other
yes.
things we have.
Thank you, Jeremy. Yeah. So, and as another level, another tier intervention, we provide Care Solace, which is a concierge, a mental health concierge, to where we can, if we feel that X student needs more support services, we can link them up with Care Solace. And really, they kind of link up based on a sliding scale of income, they linked the parents, the community members up with whether it be Kazer or if it's Medi-Cal, whatever the case is, or if it's free, based on their income, they can get free services for mental health services, for alcohol, drugs, substance use. So there's a lot of different supports for the families. So thank you, Jimmy. That's a great resource that we kind of tack on as more of a more elaborate system of support as well. Next slide.
So Scott mentioned through our intervention process, at the end of that, typically we offer cessation services and programs that we work with. And in the past, we've worked with California Smokers Helpline. For those of you in 2P, I'm sure you're all familiar with that, and probably also know that it is now becoming Kick It California. I actually went on the website today just to see if it's transitioned over. And as of right now, they still take you to the California Smokers Helpline links, and all of the contact information is still through there. However, this is something that will be transitioning. So the information, I believe, for the chat and all of that is still the same right now. If you go there, it'll refer you back to the Smokers Helpline. But this is what we provide to students that may need that additional resource, that are still trying to quit, because our intervention typically is 3 sessions, and it's a brief intervention, as Scott mentioned. So we have limited time with that student, so we want to be able to give them a resource. That way they have something to follow up with, and they have people there they can chat with, text with, provide that that support for students, in that need. Because like I said, with so many students, and I don't know if Scott mentioned this, but already in our district, in the month of September, we've seen, I believe, well over 50 infractions just around that. So there's an increase. We've seen an increase, in this first month opposed to years in the past. So we know that the lack of connectedness that students have faced throughout the pandemic, it's going to see an upward trend most likely in use. So having these types of resources available for students, and there's a lot of others. I believe HEC has some at the end. Their share as well, but this is one that we typically use with. So for our last piece, we just wanted to share a bit about some of the surveys that we use. And once again, if you are familiar with UP, you know that the California Healthy Kids Survey is something that they require. It is required for certain grade levels. However, our district does it annually. So every year we do it 6th through 12th grade. So in the past, it's been 7th through 12th. This last year was the first year that we've incorporated 6th through 12th in this. And if you're looking at the survey, it is a great option. It's not really only focused on risk factors. It's focused on a lot of other things about school climate as well. So there's a broad spectrum of information you can get from the Healthy Kids Survey, but a lot of the information targeting alcohol, tobacco, and other drugs, vaping, it's all incumbent in this survey. So if your school site hasn't taken advantage of this, and maybe you don't have the 2P grant at your district or in your school, I'd recommend looking into this. It's through Cal Schools. And like I said, it's just a great resource. Another piece of that is the California School Staff Survey, which is anonymous and just allows teachers an opportunity to kind of share their feelings about just the school connectedness with students and different aspects like that. And when we use all this to inform our program, and really, as Scott will show you in the next slide, the information that we get off there it really is what drives our programs and helps us make decisions. And when we're looking for funding outside of 2P, this helps us inform what other grants we can go through, looking at the need that our students and our community face. So it's a great resource, and a lot of really good information that you can use to build programs, not only within risk factors such as alcohol and tobacco, but other things as well. And I'll go ahead and move on to the next slide, and I can talk a little more about the data that we get.
Sure. And on top of that too, there's another survey that we do every other year, and it's called the California Youth Tobacco Survey, and that is mandatory per our grant as well. And they're random selections of schools throughout California. And if your school or schools get chosen, there's no ifs, ands, or buts about it. You have to do it. So it does provide more data. It is free, and UC San Diego is the one who operates it, and they provide $500 incentives for school sites that participate, but it is mandatory, so it can prevent future funding for tobacco use prevention education for districts if you do not participate. So we always do whenever we get asked. But like Jeremy said, with the California Healthy Kids Survey data, with 7th and 8th, we found trends where with the perceived harm of use for vaping products, it's a very low perception of harm, whether it be with great, moderate, slight, or none. Obviously, you can see that there's a lot of students feel that there's no harm, perceived harm in vape products. For 7th grade, there was 37%. For 8th grade, it was 38%. And that was with vaping products used occasionally and several times a day. So there's a lot of work to do for our 7th grade perceptions on vaping. And that just shows you that the big tobacco is winning, because all of basically they're brainwashing our youth. And they're, like Johana said, they are promoting to our youth and really, targeting them. So it's a total brainwash. So it's all of our jobs that work in the communities and work in the school sites to, help them understand that. Jeremy, next slide. Similar with 9th through 12th grade data, we're seeing that the older students are learning as they go through high school, are learning that it is more harmful, as you guys can see in perceived harm for vaping products occasionally. In 9th grade, there's 33%, and it drops down to 25, 27-ish. So they hopefully, with all of the resources that we're offering to them, as well as the intervention, the curriculum, they are hopefully learning. Same thing with vaping products several times a day. They're hopefully going from 34% in 9th grade all the way in 10th, 11th, and 12th to about 25%. So hopefully they're learning from what we are teaching them. Jeremy, next slide. And these are resources from our presentation. If you guys, obviously this is recorded too, so this can be provided to you guys, but just as an FYI, this is kind of a list of what we offer.
Joanna, do you have anything you want to mention about any of these resources at all?
Not really. Just that we'll be sharing them with you guys afterwards. And yeah, and like Scott mentioned, these are great resources to get some more information on there. And some also have resources for parents as well, like to have the conversation and everything.
Great. So this is our contact information like we have. So I believe it'll be shared out as well. So if you want to get in touch with us, please feel free to. So that's Joanna, and this is Scott and myself. And with that, I believe we are to our survey. HEC, do you want to hop in here and give us some instructions?
We will also have a Q&A after this survey, so please participate in the survey. And I believe you guys will be up for a potential gift card if you do.
Yes, yeah. So we'll be sharing, the surveys in the chat now. If you guys can please take it, it's open for everyone to take. Like we mentioned, if you participate, I think there's a question at the end. It's optional if you want to be entered into the raffle.
I believe we're going to take, are they taking the survey now, or do you want to do Q&A, or Sal, how would you like to proceed with this?
We can do the Q&A right now for those. Yeah, we can just do the Q&A. With that said, we'll now open the floor for questions. If you have a question regarding the topic of the presentation or the presentation in general, go ahead and put your questions in the chat and we'll get them answered for you. Looks like we have a question that just popped up. So the question is, do vaping rates among teens differ across socioeconomic status, or are they based solely on age group?
I think it's a little bit of both. What we've seen with trends over the years, with Twin Rivers Unified School District, we have a very low socioeconomic population. So I believe us versus, if you look at Elk Grove Unified School District, we are about half the size. I think we have about 25,000 students typically on an annual basis, whereas Elk Grove has about 60 to 63. And Twin Rivers, for example, is just about equal with the infraction base for Elk Grove. So I believe, yes, socioeconomic status does have a play into it, but then also grade and age does have a play as well. We are starting to see a lot more youth in like 4th, 5th grade start to vape, and this is nicotine and marijuana. And then students like in 7th and 8th grade starting to get heavier into just vaping nicotine. And then really 9 through 12 is where marijuana is, I think, the biggest infraction based. So yes, to answer it, I think it's both. It's age and it's also low socioeconomic status. Thanks for that question.
Yeah, and going off of that of what Scott's saying, it's also, you know, with the marketing with Big Tobacco, they are definitely targeting youth, but more specifically, you know, like the lower socioeconomic status. You can see, you know, there's a lot of like small stores, like they're mostly in those population areas, and the advertising there too is really heavy for the youth, since they are an easier target.
And kind of to piggyback on that as well, in Twin Rivers, what we see, and this could be similar at other districts, but we see our infraction base being disproportionate with African American youth, as well as the Hispanic Latinx populations as well. So Big Tobacco does spend a lot on advertising towards, like Johana said, towards these populations. And so really, we also focus heavily on supporting our African American and Hispanic Latinx populations, just because we know they're targeted heavily as well.
Awesome, thank you, thank you. Looks like we have another question from Rachel Minnick. She asks, how is COVID impacted by vaping?
So, I mean, as far as, you know, we've tried to put out a lot of information because we know that, you know, if you are vaping, there's a lot of more negative health risks associated with that. As far as how COVID impacts vaping, it's hard to say because, you know, the data that we typically get in a school year to find out what trends are, you know, we weren't able to really get that last year because students weren't in school as much. So the infractions that we typically see are school-based infractions. We do know that vaping is still occurring during the COVID pandemic. We know there's a lot of, you know, mental health aspects that go into that too, as far as like, you know, using any sort of substance. I think we're going to see really the ramifications of COVID and all of that kind of come out to play this year. Now that we're back in school, I think now that we're, you know, now that things are kind of open back up, we're going to really see like how COVID has impacted we're really trying to, since COVID's still obviously very prevalent in our districts and in our communities, we're really trying to still focus that message that, vaping, can really complicate COVID symptoms. And if you receive COVID, just the dangers that are associated with that as well. So I guess in a twofold, in the health impact of it, it's still kind of to be seen as far as what will come from COVID, but we definitely are trying to put the message out that, COVID and vaping, it's a dangerous combination.
Yeah, and CDC says that you're 5 to 7 times more likely to contract COVID if you are a vapor or smoker. So, and then like Jeremy said, the issues that come about or health effects that come about after that are much more severe.
Thank you. Looks like we have another question. How has vaping prevention tactics evolved or changed from smoking prevention or DARE tactics from the early 90s and 2000s?
We were both part of the DARE program in the 90s and 2000s. Yeah. I would say social media is one aspect of it. I just think the connectedness as far as like how you can reach people is one thing that's definitely different as far as like the tactics that are used. Before it's more just, going into school sites, handing out, information, doing classroom presentations. I think not only are, adults like in our situation able to reach students more through social media, I think the peer network and some of the programs that we do with like Club Live and Friday Night Live, I think the messaging that peers are able to provide to their other peers is really, I think, a lot more impactful, obviously, than adults telling them and providing this information to them. So I think using social networking and just having the ability to provide information in an easier, kind of more quick format, obviously, is going to be an advantage that we have opposed to how it was back in with DARE and all those other programs.
And kind of, if you think back to it with this question, it's a great question because this is your mind on drugs. I remember that egg, right? This is your mind on drugs and the skillet. But like Jeremy said, we do a lot of public service announcements with where the youth actually do that. So youth are viewing youth, and kind of similar to social, like Jeremy said about social media, they're seeing these on social media too. And as you guys know, youth are very involved in the social aspect, social media. So if they're seeing that on social media, maybe they're more, likely to listen to that from their peers. Another thing is I don't remember, Jeremy, do you recall back in the day did you ever receive curriculum based on prevention curriculum in school? Because I didn't.
No, I think that's a great point. I mean, the 2B grant does allow these more prevention, specifically focused on tobacco and vaping. Whereas, you may have a health class in middle school that talked about the dangers and effects. Obviously, Red Ribbon Week was that time, and it has been for many years, where you'd have the opportunity to share that in classrooms. But what we kind of do with our programs is more of like a complete, it's a wraparound service that we offer throughout the year. So yeah, I mean, typically if you get a referral, back when those programs were there, I don't know if, even brief intervention was a tactic that was really used. It's probably more just a suspension first mentality. And what, obviously with restorative justice and all of that, those trends we've seen in education, I think that there's a lot more proactive approach to being able to educate the student that, is caught vaping or using other products on campus. So I think that is something else that maybe wasn't done back then that now we're seeing and hoping that that's going to be a more proactive approach to having students quit using.
Yeah, and what I can share, we know that like in the past, like you guys mentioned, they used to do a lot of like scare tactics. That's what I remember when I was in school. Like I remember like, Red Ribbon Week and everything was like, don't do this, or, it's really bad for you. It was, scare tactics. But we know that, they don't really resonate with students nowadays. And it is more just having, that conversation and just educating them, especially about the tobacco industry and, like how their tactics and marketing that they're doing to them. It's just, manipulating them to use their products. And it's definitely good that, there are different ways to reach students now. All these different programs that you guys do with TUPE, and, just the students themselves, having that conversation with each other and educating each other definitely helps more than those old school tactics.
Thank you, everyone. With that said, here are some closing remarks. We would like to thank LUCHA Tobacco, Scott Kazer, and Jeremy Combs, and everyone who was able to join us today for this session. As a reminder, if you need professional development credits for today's session, please complete the post survey, which is linked in the chat. All summit attendees can also enter our gift card raffle by filling out the post-session survey. Again, the survey link is in the chat and will also be sent through email after this session. Remember to join us tomorrow at 3:30 for professional development, educator wellness, and social and emotional learning. Have a wonderful evening, and we'll see you all tomorrow. Bye.
Thank you.